Hey, what's up? Hope you're doing well. Abdullah is here. So, guys, let's discuss today some topographical structures related to head, neck, and thoracic region. So, here we have our first structure is the projection of the superior sagittal sinus onto the cranium. So, let's see what is it. First of all, you have to know what is superior sagittal sinus. As you can see here, this is the superior sagittal sinus, and in the human head it is an unpaired area along the attached margin of falx cerebri. What is falx cerebri? This one is your falx cerebri. Okay, and what it allows and what's the function of this superior sagittal sinus? It allows blood to drain from the lateral aspects of anterior cerebral hemispheres through to the confluence of sinuses. Okay, and moreover cerebrospinal fluid also drains through arachnoid granulations into the superior sagittal sinus and then return to venous circulation. Okay, so this is your superior sagittal sinus, and let's see on another picture to clarify it what is it. So as you can see here, this is your superior sagittal sinus. This is falx cerebri, and you have to show the projection of superior sagittal sinus onto the cranium. So here we have cranium, so this one is a projection of superior sagittal sinus onto the cranium. Okay, so let's see next what we have. Next we have stylomastoid foramen. So guys, let's have a look of this stylomastoid foramen on the skull. So let's see what is it. Let's zoom it a little bit, and here we are going to apply the pins to understand what is it and where it is located. So here in white pin you can see this is the styloid process. Okay, and this one is the mastoid process, and between the styloid and mastoid this one is stylomastoid foramen. So that's it. And next we have phrenic nerve that you have to show on the neck and in thoracic cavity. This is the anterior side. Anterior aspect, in this aspect you can't see the phrenic nerve. So you have to find the posterior one. So this one is a posterior aspect. Let's have a look where is the phrenic nerve. So here you can see this is the phrenic nerve. Okay, in the thoracic region, and in the neck region here you can't see because it hides behind the left internal jugular vein. And here you can have a look, this one is a phrenic nerve in the neck region. Okay, so what is phrenic nerve? It's actually a mixed motor sensory nerve. It originates from the C3 to C5 spinal nerves in the neck from the brachial plexus. Okay, so next what we have to find the internal thoracic artery. So the region for this internal thoracic artery, it will be the thoracic region, right? So here you can see internal thoracic artery, this one in the red color. Okay, this is your internal thoracic artery. So what is the peculiarities of this artery, what it originates from? It actually originates from the subclavian artery. So what is subclavian artery? Let's have a look. So guys, here you can have a look of the subclavian artery, that itself a branch of the brachiocephalic artery. It's the right one. In the left subclavian artery, it's itself the branch of aorta. Okay, so the next structure we have here is the sternocostal and lumbocostal triangles of the diaphragm. So let's have a look on this structure. Here you can find the sternocostal and the lumbocostal triangles. Okay, so this one is your sternocostal triangle, okay, which is also called as Large space. It is the small zone lying between the costal and sternal attachments of the thoracic region. Okay, and the next one you have to find the lumbocostal. Lumbocostal you can see here on both sides. This one, this is lumbocostal triangle. Okay, and this is like you can find where the diaphragm attaches to the anterior margin of the 12th rib. Okay, so the next structure you have to find the frontal sinus. So let's have a look on this structure. So this is the frontal sinus, as you can see here. It's actually the frontal sinus is one of the four pairs of paranasal sinuses that are situated behind the brow bridges, and these sinuses are mucosa lined air spaces within the bones of face and skull, as you can see, and each opens into the anterior part of the corresponding middle nasal meatus of the nose through the frontonasal duct. So what's the next structure we have here? We have Prescalene intramuscular fissure. So where we can find Prescalene intramuscular fissure? It's to find the fissure. First of all, you have to recognize the muscles. Okay, this is your anterior scalene muscle. This one is the middle one, and this is posterior scalene. And you have to find the prescalene intermuscular fissure. So this is the prescalene intramuscular fissure. So guys, the next structure we have here is the intercostal neurovascular bundle, and you also have to name the syntropy of elements. So have a look on this picture. As you can see here, this is a neurovascular bundle. Yeah, as you can see here, and it is, you can say that it's found between the middle and innermost layers. Okay, innermost layers, and this is protected by the costal groove of the superior rib of each intercostal space, and their order, like order is like, first you can have intercostal vein, then artery, then nerve. So you can recognize it as, you can memorize it like van, van. Okay, and the other bundle is found inferior to it. It's a collateral neurovascular bundle which runs at the lower edge of the space just above the inferior rib, and the order is reversed. As you can see, nerve is first, second artery, and the third v. So this order you can have van, and this one nav. Okay, so the next structure we have here, we have to show the scapular line on the skeleton and indicate the skeletotopy of the lower angle of the scapula and the transverse sinus. So our first question is the scapular line we have to show. Okay, so here it shows scapula, and this one is your scapular line that is drawn. Okay, and the syntropy of the inferior border of scapula is it ends at the level of 7th rib, 6 or 7th rib approximate. Okay, and the next question you have to show the transverse sinus. Yeah, transverse sinus. So let's see the transverse sinus. Where is it? So as you can see here, this one is your transverse sinus. So let's see the peculiarities of transverse sinus. What is it? It's actually a major dural venous sinus that connects the superior sagittal, occipital, and straight sinuses. So next, have a look on the infraorbital nerve you have to show on the poster. So let's see what is it. As you can see here, the infraorbital nerve is this one. Okay, so it's actually it's a branch of maxillary nerve, as you can see here, maxillary nerve, and it arises in the pterygopalatine fossa, and it passes through the inferior orbital fissure to enter the orbit. Here it will be the inferior orbital fissure, and it enters in this fissure to reach the orbit. Okay, so what it provides, this infraorbital nerve, it actually provides a sensory innervation of the skin. So next structure what we have here, we have interscalene intramuscular fissure. In which region we can find it? We can find it in the neck region. So to find this place, first of all you have to know the scalene muscles. This one, as you can see, it is the anterior scalene muscle, middle scalene muscle, and the posterior scalene muscle. Okay, so you have to find interscalene intramuscular fissure. So as you can find this one, between the middle and the anterior one you can find interscalene intramuscular fissure. And bear in mind, anterior and middle scalene muscle is attached to the first rib, and only the posterior one is attached to the second rib. So let's have a look on our next structure. We have capsule for mammary gland. So where we can find it? We can find it only in the thoracical region. Okay, so have a look here guys. You can see the capsule, this one. Okay, this is a capsule of mammary gland, and in the inside this is a lobule of mammary gland. Let's have a look on our next preparation. We have endothoracic fascia. So endothoracic fascia, where we can find it? We can find it in the thoracic region or in the thorax. This one is your endothoracic fascia in the skin color. Okay, so what are the peculiarities? Endothoracic fascia, it is a layer of loose connective tissue deep to the intercostal spaces and ribs. See, it is deeper to the intercostal spaces and ribs, like it's behind. Okay, and this fascial layer, it's the outermost membrane of the thoracic cavity, means parietal layers like parietal pleura and visceral pleura, it's behind this layer, behind endothoracic fascia, and behind pleura you can see the lungs surface. Okay, and this endothoracic fascia contains variable amounts of fats in order to reduce the friction between the layers. So that's the endothoracic fascia. So the next structure we have here, interaponeurotic cellular tissue of the temporal region. As already indicated here, where we can find it in the temporal region. So guys, let's see your interaponeurotic cellular tissue. So here you can find it here. This is the interaponeurotic cellular tissue just above the zygomatic arc. Okay, so let's see the next process, next structure. What we have? We have next mental nerve. So let's see what is it. So here guys, you can see mental nerve. Okay, this one, which is itself a branch of inferior alveolar nerve, which is itself a branch of mandibular nerve, and mandibular nerve, it's the branch of trigeminal nerve. So what's the function of the mental nerve? It actually provides a sensation to the front of the chin and lower lip, as well as the gums of the anterior mandibular teeth. Okay, as you can see here. So guys, the next structure we have. So guys, the next structure is the subclavian artery with brachial plexus in the interscalene space. As you can see here, the anterior scalene muscle, middle scalene, and posterior scalene muscle. So this is your interscalene space, interscalene intramuscular or interscalene space. So have a look on this picture, you can clearly identify it. So as you can see here, this is the anterior scalene muscle. Okay, anterior scalene, and this is the first rib, and this is middle scalene, and here you can find your subclavian artery with the brachial plexus. Okay, so this see this aspect, this is your first rib, anterior scalene muscle, middle scalene muscle, and in the interscalene fissure or space, you can find the brachial plexus and subclavian artery. So next, see what we have here. The next structure we have here, retromammary cellular space. So what does it mean by retromammary? Retromammary means behind the mammary gland. Okay, so this is the ulcer, but actually this is the space, retromammary cellular space. And the next structure we have here, root of the right lung. List the elements, specify the syncope and subaponeurotic cellular space of the temporal region. So let's see first of all root of the right lung, what is it? So as you can see here, this one is your right lung and this is the root of the right lung. Okay, it is actually located on the mediastinal surface where hilum is located. So what is hilum? Hilum is a structure which gives rise to many structures to pass to the lungs. It includes bronchus, pulmonary arteries, veins, and other bronchial vessels, nerves, and lymph nodes. So, what's the syncope? Syncope of the lung root. So, supero-inferiorly, from superior to inferior in the right lung, we can find first principal bronchus, pulmonary artery, and pulmonary veins. So literally we can say that BAV, okay, bronchus, artery, veins means BAV. And the scaletotopy, you can say the root of the lung is located at the level of thoracic vertebra. From where to where? From T5 to T7. Okay, so next you have to show what, yeah, subaponeurotic cellular space of the temporal region. So let's see here. First, we already discussed here the interaponeurotic cellular tissue, right, which is located above the zygomatic arc, and this one is subaponeurotic cellular tissue. As you can find here, this one, this is subaponeurotic cellular tissue, and it's medially you can recognize it's a muscle, temporalis muscle, and lateral to the temporalis muscle you can find the subaponeurotic cellular tissue. Okay, so the next structure what we have here, we have sphenoid sinus, and the pair of sphenoid sinuses are separated in the middle by a septum of sphenoid sinuses. And as you know is like frontal sinus communicates with the middle nasal meatus, and this meatus communicates with the nasal cavity via the opening of sphenoidal sinus. And about these sphenoid sinuses, you have to memorize that they are not equal in shape. They are vary in size and shape, and they are usually asymmetric. So the next structure we have, so where we can find it, we can find it pretracheal, so we can find it in the neck region. So let's have a look here. Here you can find this is your trachea. It's pretracheal, so it means it's in the front of the trachea. Okay, so this is your trachea, and here you can find the pretracheal cellular space, and here it's your thyroid gland. Okay, and let's see like on the transverse section how it looks like. So as you can see here, this is the trachea and this is thyroid gland. So under the thyroid gland, when you will clear the thyroid gland, so here you can find the previsceral or pretracheal cellular space. Okay, so the next structure we have here, pleural sacs. So what is it? Sac, first of all you have to know what is sac. Sac, it's just like a cavity. So what is pleural cavity or pleural sac? So guys, have a look here. As you can see is the parietal pleura, visceral pleura, lungs and ribs. You already seen this picture before, and here you can have a look of the pleural cavity, or you can also say that it's the pleural sac. So what's the function of the pleural sac? It's actually contains a fluid to reduce the friction between the pleura, between the visceral and parietal pleura. Okay, so it has a function, protective function. So the next structure we have here, left lung root. Okay, so let's see about what's the left lung root. So what's the skeletotopy of the root of the lung? It's actually located at the level of thoracic vertebra from 5 to 7, T5 to T7. Okay, and the syntopy of the left root of the lung, it's first supero-inferiorly. It will come pulmonary artery, then main bronchus, then pulmonary vein. So it's actually ABV. For the right one, it's BAV, and for the left one, it's ABV, as you can see here. Okay, so next structure we have angular vein. So where you can find this vein, you can find in the facial region. So here you can have a look on the angular vein. This is a angular vein. Angular vein is actually the branch of what? Here you can see is the internal jugular vein, and this is a angular vein. Okay, and angular vein gives rise to which vein? Facial vein. Okay, so let's see the next one. Next you have retrovisceral cellular space. Retrovisceral cellular space, where you can find it? You can find it in the neck region. Let's see first the sagittal plane. So guys, here you can have a look. It's retrovisceral, right? So viscera means internal organs, so retro means behind, so retrovisceral means behind internal organs. Here you can see the trachea, and here you can see esophagus. So behind this one, this is retrovisceral cellular space. Okay, this whole. Okay, so let's see it on the transverse section how it looks like. So as you can see here, this is trachea and this one is your esophagus. Behind esophagus you can find retrovisceral cellular space. Okay, so the next question we have here, endothoracic fascia. We already discussed this one. Let's see one more time. So here you can have a look of endothoracic fascia, which is shown in the skin color here, this one. Okay, so it's actually, what is it? Endothoracic fascia. It's anterior to the pleura. As you can see here, this one is your parietal pleura, and this is your uh, visceral pleura, and this is the surface of lungs. And anterior to endothoracic fascia, you can see the ribs and other structures as well. Let's see the next structure we have here, superior vena cava, aorta and pulmonary trunk. So what will be the region for this? The region will be thorax. So this is the thoracic region. Here you can see this is the superior vena cava, this is the aorta. Okay, this one is the pulmonary trunk. So guys, that's all for now. See you in next video.